Ruth Tretter. Thank you so much for attending this presentation about addressing the medical challenges of RV residents. So a little bit about my background. I've been registered nurse since 1995. And in that time, I was a traveling nurse for 13 years. I worked in 15 states and 3 countries. And so I just kind of got accustomed to a nomadic kind of life. Now I'm a nurse researcher and educator at Montana State University. And my mission is to work with vehicle residents, caregivers, and policymakers to promote equitable opportunities for health for vehicle residents. So I was drawn to this topic because I have spent about half of my life traveling. I grew up in a military family. We often like to camp or stay in a pop-up camper rather than staying in a hotel. We took long cross-country road trips every summer to visit family. And so traveling and staying in a vehicle or an RV was just kind of pretty natural. So I also spent some short times when I was in between jobs, living in a tent or an SUV just to save some money. And I just felt like it was a good option. So as a healthcare professional, when I was traveling around, I should have been able to keep up with the recommended preventative healthcare and appointments and things like that. But sometimes I just delayed or skipped care because of the barriers that I encountered when I was traveling. So the inspiration for this project that really comes from some trips that I took with my mom. This is a picture of my mom in front of the pickup camper. We had the opportunity to spend a couple of months traveling through the desert. And we met so many wonderful people who lived and traveled in their RVs full time. So I really just wanted to understand how they manage their health care. Knowing that our healthcare system is generally built for stationary people. So I was pretty surprised when I looked into seeing the numbers of people, that I met who were living in their vehicles and RVs. When I looked into the literature to find out, what do healthcare professionals do differently when they're taking care of people who live in vehicles or RVs or they're nomadic, I found that there really wasn't much of anything written. And this is an issue because healthcare professionals have a responsibility to provide culturally congruent care, but people are often assumed to be sedentary. So if we ignore people's mobility, or if we ignore, the different home environment that a vehicle or an RV provides, then our healthcare could be less effective. So I needed to understand mobile vehicle residents' healthcare experiences. So I set out to understand what are the healthcare experiences of RV dwelling full-time nomads, and what makes it easier or harder for them to get healthcare. And this was my research team, Dr. Mary Neese, Dr. Omatoa, Dr. Maury Burnham, and Dr. Buo. And they were able to provide expertise from a sociology perspective and just years of experience in research of health. So I figured the best way to find out about people's healthcare experiences was to go out and talk to them. So I moved into an RV and spent 8 months traveling around 8 states, talking to RVers to understand what was going well, what wasn't going as well, and what could we do differently in the healthcare professions in order to make things run a little smoother. So I wanted to meet people from with diverse backgrounds and circumstances. So I went to a lot of different campgrounds in urban and rural areas, like city, county, and state parks, open public land, fairgrounds, private RV parks. I spent about a third of my time on free campgrounds, budget campgrounds, and RV parks. So the study was discussed with people who showed interest, and then they were asked to invite others who might be interested. I also attended an RV rally. So people chose what would be the best place for an interview. And so we did a lot of interviews at picnic tables and over the campfire. Had a lot of conversations and recorded 25 interviews. We had 18 women, 7 men from ages 35 to 81. 12 were traveling alone, 18 were traveling with long-term illnesses, and the median time that they had been traveling was about 3 years. So in compiling all of these conversations and stories that people shared with me, we identified 3 themes that kind of summed up the overall healthcare experiences of people who live in their RVs or vehicles full-time and travel around the country. So the first of them was this overwhelming logistics. So actually, one of the most common responses when I ask people, how do you access healthcare? Or how do you manage your healthcare on the road? Is they said, don't get sick. So, you know, that's sometimes it was a good sign, sometimes not a good sign. You know, sometimes don't get sick meant that they tried really hard to adopt a healthy lifestyle so they wouldn't get sick. But other times they were really trying not to get sick because the thought of trying to arrange healthcare on the road was just so overwhelming. So this is a quote from a middle-aged woman who had an online business with international employees. And that was okay. She could, you know, she could manage that. But when she thought about trying to seek healthcare, she said the logistics are just overwhelming. Sometimes it just feels really overwhelming because there's so many logistics trying to figure out, like, where am I going to be? Who's going to be the doctor of that place? How many places do I have to call to make that appointment? When you're traveling and having all of the barriers that you already have, how do I even navigate and find that right person? So with this dread of trying to get healthcare, had caused her to neglect some health issues like, you know, pain, recurrent pain that she was having, some dental issues, several things, you know, that she felt need to be taken care of, but maybe it just wasn't worth it to delve into that calculation of how to get care. And so other folks would say, we don't need healthcare. And this was interesting at first when people said they didn't need healthcare. I assumed, well, maybe they don't need healthcare because they're healthy, or things like that. But as I heard more stories and considered them in context, you know, with each other, I came to understand that a lot of people decided that they didn't need healthcare because they had experienced barriers to healthcare access, or maybe they had negative past experiences with healthcare access. They had concerns about the culture of medicine that influenced their desire to interact with the healthcare system. So maybe they needed care, but they didn't need this healthcare. So this quote is from a person who was traveling and was prescribed a medication. And they said, the medication they had wanted me to try for fibromyalgia, I decided to opt out of because it was just too expensive. I was also living in a climate that was really bad for fibromyalgia. So it was a bummer then, but I don't miss it now. Being out in nature, staying away from inclement weather, like the desert, is a really good environment for my fibromyalgia. So for this person, you know, maybe they would have preferred to have the prescribed medication, but because of these lifestyle changes, they felt like they no longer needed that care. And the lifestyle change in this particular instance was travel itself, being able to travel to climates where they experienced fewer symptoms. And then some folks who I talked to felt like they did need care and they worked really hard to get it. So this was orchestrating a web of care. As one gal who lived in a Class B RV said, if I need something, I'm always going to figure out how to do it because I travel a lot in the West, I've gotten to know some people throughout the Western states that I can go back to, that I've liked and so willing to go back to. So the people who orchestrated a web of care really put an extraordinary amount of effort into coordinating care that they received from different providers across the United States. So often many people would have a single medical base and have telehealth services. Others might have medical bases in 2 places in the country, and they would coordinate the services between providers in those 2 places. And then there were still others who had providers kind of scattered throughout the country that they trusted and could go back to. And so this did require a substantial amount of time and effort to research and coordinate. So next, I just wanted to go through some challenges that people experience. And these are common challenges that, multiple people described, and some solutions that they suggested as well. So one challenge was finding healthcare in an unfamiliar area. So when you're pulled up somewhere and you're in a campground and you don't know the town, you don't know the providers, who do you go to? Who's going to accept you for an appointment? Who's seeing new patients? Who accepts your insurance? What services do they provide? And are they the services that you need at that time? So finding a local healthcare person can be pretty time consuming when you're not familiar with the area. For example, there was one person who was traveling with asthma and unfortunately got sick on the road. And the first step was that they just tried as hard as they could not to go to the doctor. They really procrastinated that, knowing that it would be a challenge to figure out where to go. And so they said that they finally decided to go to the emergency room because they were really concerned about their life. So they went to the emergency room, and of course, they were treated there and advised to go follow up with their primary care provider. And of course, they didn't have a primary care provider and they weren't familiar with the town. And so they tried to find an appointment, called all the clinics in town, and weren't able to find anyone who would see them. And so they ended up going back to the ER twice, which was a big expense. And, they were grateful for the care, but paying off those bills was a big hardship. It took several years. And so some things that were helpful that other nomads mentioned were federally funded health centers. So this underlined health centers here is a link. So when these are posted later, you can click that to find this website, or you can scan this little barcode, QR code down here. This is a website that allows you to look up health centers. And these health centers will see anyone on a sliding scale basis. And they're available in a lot of rural areas as well. So they're a really good option. And then other people said that they would talk to their campsite host or maybe their neighbors that were camping near them, look up online reviews for providers. And there's also, some people have access to healthcare navigators. Sometimes these are provided through your insurance company. So if you have, if you're able to call your insurance and check into that, you may have somebody who can be assigned to you to help you decide where to go when you're feeling unwell. And then another challenge was dealing with caregivers who were unfamiliar with the concept of nomadism or with vehicles as a home. And so, and we've heard this, I think, in some of the other presentations this weekend too, where caregivers tend to assume that people who live in vehicles or RVs are either on vacation or homeless. And both of these assumptions could be harmful because, if people were assumed to be on vacation, they might be told, well, you need to take care of that when you get home. But they weren't really planning, they are at home, they're at home on the road, and they're not really planning to go back. They're domicile location could be 1,000, 2,000 miles away. So, you know, sometimes they really had to advocate for themselves in order to get past that block to appointments. And the other assumption is concerning, you know, and some vehicle dwellers may consider themselves homeless, some may not. But this could be a particular concern for parents, because I met a few families who traveled around and lived in RVs, who were concerned and reluctant to seek healthcare because they were worried about being referred to Child Protective Services. And, you know, so that could be definitely a deterrent. Now, most of the participants just wanted to be treated like regular people. You know, they didn't want to be treated like they're in their last resort for housing, or that they're on vacation, sort of like gallivanting around. So this was a challenge. I had a gentleman who said that he really spent more time trying to explain his lifestyle to his providers than he did his actual health conditions. Now, this quote is from a middle-aged woman who had a long-term condition that required regular follow-ups. And she felt like whenever she called the clinic to try and make that appointment, they just don't get it. Like it totally short circuits and just doesn't compute. And they don't understand why you wouldn't always be here. And so it was really difficult to get through that gatekeeper at the front desk to get an appointment. But she felt like the nomadic lifestyle was very important to her mental health and really helped her to, she received a lot of support from the RV community that was beneficial to her health overall. Another challenge was in being stuck in one place waiting for appointments. So for those of us who live in houses, you know, this may be inconvenient, but you can still continue to live your life while you're waiting for an appointment. This was not so much true for RV nomads when their life is structured around movement. Being stuck in one place waiting for a moment could mean missed opportunities, like maybe they have a job that they need to get to, a family event, some other kind of event, you know, that they need to see. They might be trying to move on before the weather changes, you know, because you have limited temperature control in an RV. And so being stuck for an appointment was a big deal. So very much a deterrent to seeking care. As one person said, if you get stuck somewhere, there's a huge expense that gets associated with it. If you think about campground fees, they're often $40 to $60 times 30 days. Like if it's something that's going to require follow-ups. So for this particular person, they lived on public lands and they usually moved every 2 weeks, you know, to align with the stay limits in those places. And so they weren't expecting to pay, you know, $800 a month to wait for an appointment. And about 2/3 of the people who who interviewed with me spent most of their time on public lands. So this was a story about not having an address. So a young couple, this couple was traveling because they loved nature and the outdoors and participating in adventure sports. But when they were parked out in a quite remote area, one of them had an accident, and his spouse said, you know, that was the single worst moment of my life, seeing the blood gushing out of his wrist. I just remember that feeling of, I don't know how to tell them where we are. Everything turned out okay for this couple, but some resources that other nomads recommended are things like smartphones, Smartphones do have the availability to locate, to send the ambulance crew your location in some cases. And several nomads said, it was a good idea to get a good first aid kit, get some first aid training. And when you pulled in, to kind of have an idea of where the nearest hospital was, just in case, so that you know what to do if something goes wrong. Does anybody have any questions so far? I've been talking and talking. I don't see any
Not yet,
questions.
everything's good.
Okay. So another challenge, this was a very common challenge, was the challenge of insurance that only covers within the state boundaries. So for example, this person said, I've had nomads near dead out here trying to get across the state lines to their home state to have the insurance. I've driven one 700 miles to get them across the state line to the first hospital. So there are many insurance policies that limit payment to services provided within the domicile state. Some will pay for emergency services outside of the state. Some of them are again, a little bit more limited. So it's a good idea to find out, what services your provider covers. Some insurance companies will decide if it's an emergency after the visit, depending on the diagnosis, and decide whether to cover it at that point. This was very much a challenge for people who were self-employed or were on Medicaid, because those are, the healthcare exchanges and Medicaid are state-based services. And they're quite variable as far as, what they'll cover out of state. Some participants had several insurance policies that they used to cover separate services. For example, some people had a transportation insurance, which, if you had a medical issue, would actually transport you in your vehicle back to your domicile state. So that was an option for some, but probably the most useful thing I think here was to talk with an insurance broker, agent, or navigator when you're setting up your policy, just to make sure that they can give you some recommendations about what the best option is for a mobile person. And then I also recommend policy advocacy, so that we can maybe try to reduce the number of issues that we have of traveling over state lines. As one of my, the people I talked to put it, like, when I drive over the state lines, my car is insured, but my body isn't. It doesn't make sense. Oh, and one more thing here is that sometimes people, when they realize that what they could afford was insurance that was only applied to their domicile state, would actually decide to defer getting insurance altogether, because it wouldn't make sense to them financially. So for example, if they only spent 1 month a year in their domicile state, then their insurance would only cover them for that 1 month. So it's not really an equitable, option. Another challenge were the boundaries to telehealth. And so this was interesting because I would say probably maybe half the people I talked to could access telehealth, and the other roughly half couldn't once they got over state lines. So it seems to be pretty inconsistent as far as implementation on this. There are a lot of barriers here with getting telehealth outside of the state, probably the largest one being licensing of providers to go over state lines, and then also payment for services and things like that. So I think this is another place where policy advocacy could do a lot of good. to kind of spread this around. And then there are some national telehealth services that you can access that aren't too expensive. And then of course with telehealth, you want to use this for sort of like, not your serious illnesses, but urinary tract infections, colds, flus, things like that. A lot of times when people were not able to access telehealth, then they had to go to providers that they were unfamiliar with, or they might just put off care. And another challenge for people who lived in RVs and vehicles was maybe their RV isn't set up with the amenities that they need to follow a plan of care that they've worked out with the provider. So, it has limited space. They might be rationing electricity or water. If they're not plugged in, they may have refrigeration or not. And so option here is to just, advocate, try to make a collaborative plan. And so basically, like, for example, one person I talked to, they had needed physical therapy for back pain, but they were in about a 16-foot trailer. So they didn't have anywhere that they could lay down and to do back exercises. And they were also traveling. So they needed to coordinate the care within their movement. So what they did, they talked to the physical therapist about it and made a plan where they would have their appointments closer together while they were in town. And then the physical therapist gave her instructions for what to do after she left town. And she just adapted the exercises so that she wouldn't have to do them lying down. Another example is a gentleman who was needed to wear a CPAP for his breathing. He had sleep apnea. And he said, well, I can't, I can't use this because I'm going to be off the grid. But his physician was able to supply him with a 12-volt adapter so that he could use it even when he was camped without hookups. So this was the general advice, when I asked Nomads, what would you tell somebody else, somebody who's just starting out, and how they should take care of their health while they're on the road? And the recommendations were become an expert in your health. So basically know what you need, this is for, like, when you're managing long-term illnesses, if you can meet with your doctor and then ask them what you're going to need through the year, and then you can plan where you're going to be, get those services, plan those services at the location that you're going to be at that time. So establishing primary care was important, even for traveling people. So primary care relationship has been associated with improved communication and trust, a better likelihood of receiving appropriate care, and improved health outcomes. And so this is pretty important, and the people who I talked to did value having a primary care that they trusted. Sometimes though it was challenging to coordinate care when they were in other places or traveling. So something that helped with that was considering health systems and telehealth. So maybe when you're deciding who you're going to choose for your primary care, consider if they're a part of the health system. People who had care through health systems reported that it was just easier to navigate because the medical records were shared amongst all the providers. And so they had everything like in one place. And using patient portals, they had to learn how to use one electronic health record instead of a different one for every doctor. And then, with some providers offering more telehealth services than others, that's just a good thing to consider maybe too when you're trying to decide who your primary care provider is going to be. And then for insurance as well, if you're not, there are a lot of considerations that go in, to think about when deciding where to have a domicile address that you can use for paperwork and things like that. But one of those considerations should be the the healthcare that's available in that place, because there's wide variations, particularly in those Medicaid and insurance exchange plans from state to state. And then once you figure out what you need and you're an expert in your health, you want to feel free to advocate for your needs. And so I think that people are in healthcare, you know, they're not accustomed to meeting as many of them have not talked with people who are nomadic or live in vehicles. And so they may not understand the challenges that it presents. And so, and just, you know, please feel free to say where you're going, what your plan is, and let us know how we can best accommodate. And then, of course, carrying medical records is important so that they can pick up where the last provider left off. This could be a patient portal. But, you know, if you have had a visit somewhere around the country that's not in your medical base, not your domicile, then you want to make sure and get a copy of those records and keep one with you and send one to your primary care provider so that everybody's in the loop on what's going on. And then the last one, people said, you know, keep a good first aid kit and be prepared to provide first aid. This is particularly for people who are parked out in the you know, far from services, because it might be a little while until the ambulance arrives. So some tips for collaborating with Nomads. These were suggestions from Nomads. And I thought it was interesting because these are things that we are trained to do as healthcare providers anyway. So very sensible suggestions. Ask Nomads how long you'll be here. When are you going to be back? And can you think of any reason why this plan of care would not work? You know, these are just important considerations to make sure that when we're designing care for people, that it's actually going to be effective. And then the people who are able to coordinate their care across the country, some of the things that help them do that were appointment flexibility. And this is something that is important that everybody in the clinic, you know, is aware of, because sometimes the person who is the gatekeeper to those appointments is somebody sitting at the front desk. So I think it's important to educate not only healthcare providers about, you know, the challenges of the lifestyle and the resources, but also the front desk staff and like everybody that works in that office. Some places I've seen decide not to have telehealth for various reasons, and I think that's just important for facilities to consider that if they're not going to do telehealth, you know, there's estimates are between hundreds of thousands to millions of people living nomadically in the United States. And so, you know, when making those decisions, maybe consider how that might affect people who are mobile. And another option, you know, 12-volt appliances for healthcare devices when they're available. Those will, you know, may work better for Nomads. There's some national pharmacy chains. So most of the people I talked to used Walmart and CVS to transfer their prescriptions along as they traveled. And they talked about the importance of, you know, having large prescriptions if possible, and then not waiting too long to get those filled and kind of anticipating your route. So if you know you're going to be somewhere in 2 weeks, it might be a good idea to call the pharmacy where you want to pick it up and ask them to transfer it from the last place before you get there, so that when you're there, you can just run in and pick it up. And some national lab facilities that people used were LabCorp and Quest Diagnostics. And this was really useful for people who had chronic illnesses where they had to get certain blood work done every few months or so. What they would do is just ask their provider to write them a prescription. And then whenever they were going through a town that had a LabCorp or a Quest, they would just get it drawn as long as it was within the recommended time frame. And then they could meet with their provider through telehealth to go over the results. And then, of course, shared medical records. And again, if you have, it's best to have shared medical records within a health system or access to patient portals. And then policy advocacy for nomads. So we know that a lot of things impact people's health. And so housing is also healthcare. And so it's important for us to understand, what might influence somebody's health when they're living in a vehicle or they're nomadic on the road. One of the things that can really harm people's health is forced dislocation. So the American Public Health Association has a policy statement that against forced dislocation of people who live in vehicles or in camps. And because of the negative impact on health, so it exacerbates or makes mental and physical health issues worse because, in part because of the stress that it causes. It also diminishes trust in service providers, and it makes it harder for mobile providers who may be providing outreach to people to follow up on programs of care for these chronic illnesses. People can lose their medications, and they also have disrupted sleep, when they're woken up and asked to move on. And, these are big issues. And so if you are advocating for nomads or other vehicle residents, you might point out that people who are subjected to forced dislocation have higher costs for care because they have increased numbers of emergency room visits and hospital stays. And I think I'm most interested in the health outcomes, but sometimes when you can bring in that conversation about cost, it might sway people who are, focused on that aspect. So nomads and other people who live in vehicles have a right to equitable access to care and payment for care. And the word equitable, that's a little bit different from equal. So equal means like you say, everyone has access to the same health insurance policy. The problem is that that same health insurance policy won't benefit everyone the same. So for example, when we were talking about nomads who were not able to get interstate insurance, their insurance only covers them for the month that they're in their domicile state. That's not an equitable option for them because 11 months of the year, it wouldn't benefit them. So it's important to, educate policymakers about vehicle residency and mobile lifestyles. And I'm so excited about the mission of the National Vehicle Residency Collective because I think that just getting more people talking about this lifestyle or people who are living in vehicles, maybe by choice or not by choice, either way, we just need to kind of include them in the discussion, not just to get into housing, but if they're living in their vehicle right now, how do we take care of them today? So I see there's a couple of questions. Why isn't there a central US government-run medical records service? That's a really good question. And there are a lot of people who are in support of a central US government-run medical records service. And there's also a lot of people who are not because they're worried about privacy and they're worried about anyone being able to access their medical records. So actually, when I spoke to people around the country, well, in these 8 states, about what they wanted, many of the people who I spoke to were not in support of a national government-run medical records service. And what they were interested in was maybe like a USB stick or some kind of record that they could carry with them because they didn't want to have people looking at their medical record unless they were seeking care. And I see I can get 90-day supplies of my physical health prescription and see my doctor yearly. I dropped mental health prescription due to needing to fill them monthly and have regular check-ins. Any suggestions? Mental health prescriptions actually are a challenge because some of them are controlled substances, which makes them much more difficult to transfer across state lines. I would say if you need to fill them monthly and have regular check-ins, I think probably might be a good option to talk with your provider, see if you can do the check-ins. It depends on the specific medication. So the laws vary from state to state. But I think it would be good maybe to find out what they are for that particular medication and whether or not you could do those check-ins through telehealth. And that would probably vary depending on the provider and the medication. Another thing you might try is calling if you have an insurance provider, calling them to see if you have access to a healthcare navigator. The US is, I've heard, the only country that has actually a whole position created to help people navigate the healthcare system because of its complexity. And sometimes insurance companies do have those available if you ask for that. There might be somebody who could help you figure out the nuances of this particular situation. So it looks like we've got just a few minutes left. So I want to, what to learn next? I want to learn more about the stories of families and vehicle residents who are not as mobile, people who maybe stay in their communities but still live in a vehicle. You know, there's under the big tent. We want to include everybody. And then I'd like to work with vehicle residents to learn about, you know, their priorities and then maybe test some solutions. So these are solutions that were suggested by Nomads, a healthcare app, you know, where Nomads can post provider reviews to say who was good at working with them and their mobility. An online guide to regional health risks, vehicle residents who are trained to assist community in community healthcare navigation, mobile clinics, and increased access to telehealth. And similar programs have been successful with other groups. So in conclusion, I think the most important takeaway is talk to people who live in vehicles, include people who live in vehicles and nomads in policy decisions, and address barriers to equity in healthcare access. This is my virtual business card. I would love collaborators, you know, so if you're a vehicle resident who would be interested in working together on a project, or an academic or service provider, policymaker, there's a lot of work to be done. So anyone who might be interested in working together, please scan that and send me an email or give me a call, and we look forward to talking to you. And I see somebody put in the chat, that would be great if the patient had the option to opt in. They would be protected by the Health Insurance Portability and Accessibility Act, and in terms of who could access their records. And that is true. There are you know, very strict laws about accessing medical records. And the intent is that we don't Health Insurance Portability and Accountability Act, sorry, that we don't access them unless we need to access them. So I don't know if, you know, if that helps anyone to feel more confident about that, but definitely this is a good area for policy advocacy. And it really affects anyone who ever leaves their neighborhood. Because any of us could get sick, you know, in an outside location. I'm going to put my email address and my phone number in the chat, just in case anybody's tuning in by phone, so those can be shared. So thank you so much, everyone, for coming. This is just a very, I'm beginning this program of research, but I think that there's still a lot of work to do, and I'm excited to dig in.
Hi, I'm sorry to interrupt here, but um, I'm looking for your information. I'm on my phone listening. Oh, there she goes. Okay. You posted it, but it didn't come through. But now the chat person has. All right. Thanks.
All right, and I'll also put it on I'm going to be submitting the PowerPoint, so I'm not sure where those are going to be posted after the session, but I'll plan to leave my business card on there too, just in case anybody wasn't able to capture it.
Thank you.
Thanks for being my mod. Appreciate it.
No problem. Hopefully, I didn't cause too much of a catastrophe.
Oh, I didn't. Oh, it's closed.